Hello, I am Dr. Amol Talaulikar. I am a consulting urologist attached to SaiShree Hospital. I have been practicing urology for the last 20 years. It gives me great pleasure to speak to you about stones in the urinary system. Now, stones in the urinary system are what are called our bread and butter. And if anybody has experienced a bout of renal or ureteric colic, he would never forget it in his life. The intense pain and discomfort that one experiences during these episodes is something that you can never forget. Now, if you divide stones in the kidney, you can broadly divide them into three parts. One is stones in the kidney, stones in the ureter, and stones in the bladder. Predominantly, stones in the kidney are sitting in a large area and they do not cause any discomfort unless they come to the junction of the kidney and the ureter. The ones in the ureter are the most painful, and because you have a narrow space and these stones are making an effort to come out or get expelled, they cause intense pain and discomfort. The commonest complaint that a patient comes is with severe pain that is there all the time. Classic features of this pain is that it comes in waves and it radiates from the loin to the groin area. The radiation is reminiscent of the fact that this stone may be moving, or the fact that there is an intense effort of the body to try to expel this stone. Sometimes associated with obstruction you can get fever, and the patient also complains of fever when he comes. The first thing that we do when a patient comes with intense pain is to make him comfortable by giving him analgesics. The commonest analgesic that we normally prescribe is diclofenac sodium. Diclofenac sodium gives intense relief. Normally we give a test dose of this and then inject the whole analgesic. Once the pain subsides, we do basic investigations like a urine routine to look if there are microscopic traces of blood in the urine. And the mainstay of the investigations are a sonography which tells you where is the stone, if you do detect one, the position, the size, and the level of obstruction the stone is causing. Once all this information is gathered, then we decide whether the stone needs an intervention or not. Intervention or not is decided on some factors like the size of the stone. If the size is below 6 mm, normally we do not intervene unless the stone is a hard nut to crack and it just is not passing out over a period of time. Stones above the size of 7 mm need an intervention. Currently, intervention is non-invasive. We do it endoscopically by passing telescopes and break the stone. If the stone is in the upper part of the ureter, you can use non-invasive methods like lithotripsy. Now, as far as the stones in the kidney are concerned, kidney stones, we can make a small puncture in the kidney, break the stones and take them out. Obviously, this would need a different talk to talk to you about renal stones. As far as the stones in the bladder are concerned, the urinary bladder stones commonly cause difficulty in passing urine and sometimes obstruct the passage of urine. These stones are dealt with by passing a telescope and crushing these stones. This, in a nutshell, is a small surmise about renal stones and their treatment options. I hope you found it useful. I would be more than happy to help you if you do have any queries about this, and if you unfortunately are in an episode of renal colic, we are always there at SaiShree Hospital to look after your discomfort, to allay your apprehensions and to treat it. Thank you very much.